My name is Loretta Lukic, and I'm the clinical director at 12 Palms. I oversee the clinical aspects of the program. That incorporates so many things. What clients get assigned to what counselors, the group schedules, what type of information is presented in the groups, how clinicians do individual sessions, how they do family sessions, how they present didactic materials in the group, because clients who come into our program get bored really quickly. So once they get through, if they go through the detoxification phase of treatment, they end up feeling like they're hearing the same material over and over again. So it's really important of how the material is presented, because they have to get the bottom foundation, the basics of addiction and relapse prevention in order to be able to have those skills for long-term recovery. Plus, I do all the quality assurance. I collect all of the data. I do surveys with clients. I do surveys with their families to make sure that we're providing the services that we need to provide so that they get what they need. If you came into this program today, you would orient to the program, get to know all the staff members, kind of get used to the schedule. You get a handbook that gives an overview of everything that you're going to be engaged in. And then you get engaged into the clinical services. So in the morning, we do true therapeutic processing groups. The only people who lead those groups are licensed clinicians. They're either licensed mental health counselors or licensed clinical social workers. And they do true therapy in those morning groups. In the afternoon groups, they're didactic educational groups. We teach them about the 12 steps. We break down the 12 steps for them. We teach them about sponsorship, relapse prevention, the psychological aspects of addiction, the emotional aspects of addiction, codependency, family dynamics, what it's like to come from a family that has addiction, the role that they play in their family, teaching them about the skills that they need to attain long-term sobriety and what that's going to take, that it's not just learning the information is one piece and then being able to apply it, integrate that into who they are is a whole other piece of recovery. And we teach all of that through every single day. The topic remains the same. The information changes because we keep raising the bar on the level of information that's given to them. The difference between 12 Palms and other treatment programs is this is the smallest staff-client ratio that I have ever seen, that there is a 1-to-4 ratio. So for every therapist or counselor that's here, they only have 4 clients on their caseload. And I can tell you that because I'm a CARF surveyor. So I travel around the United States like once a month, and I survey drug treatment programs to make sure that they're meeting the standards to be an accredited program. And so I'm well versed in what services are offered in other substance abuse treatment programs. Anywhere from maybe 15 and above. Some programs cap out at 15, so they're lucky if they're meeting with their counselor once a week. And we have our clients on our highest levels of care meet with their therapist and their counselor every day. It's amazing to see the difference, in the outcome for the client, because they get direction. They get a huge safety net underneath of them, that gives them that security to then keep moving, keep progressing, keep working on treatment goals. And the one thing with the population that we serve is the majority of people that come into substance abuse treatment, they don't attain any goals. We got a lot of young people here who have never graduated high school. So for them to attain A treatment plan goal is a huge thing. To get a 30-day chip is a huge thing. Some of them haven't spent 5 days clean, let alone 30, in years. So that staff to client ratio is a really big component of this program. And you want a low ratio because the client gets better quality care. Their issues are addressed, they're ongoing and addressed more frequently. The staff member is able to touch base with them. You know, if a staff member has 15 clients on their caseload, they're not able to see those clients every day because you have groups going on, there's family contacts that you have to make, there's referrals that you're calling, the clients are involved with. They could have legal issues, so they're talking to attorneys, they're calling probation officers. You wouldn't have the time to be able to meet with a client the way we meet with clients here. Once somebody completes treatment here, once they leave, regardless of how they leave, we do a 72-hour follow-up. If they're going to the next level of care and they're doing it back, in their home state or back in the community, which could be around here, we check to make sure that they kept their appointment, that they're engaged in treatment services for who we set them up with when they leave here. That they're going to a meeting, that they got a sponsor, in a home group that they're establishing, or getting established with. Then we do another follow-up 30 days later, another one 60 days later, 90 days later, and a year later. Every state in the United States has specific standards, licensing standards for somebody to open up a substance abuse treatment program. And there are people that open up substance abuse treatment programs that only remain at those standards, meeting the requirements of the basic standards that are set by the state. There are other programs who want to be the best that they can be. Those programs go for accreditation. CARF is an accreditation body. 12 Palms is being surveyed on the 6th and 7th of September. I happen to be a CARF surveyor. So this agency really benefits because I bring all those standards here and make sure the agency meets them. And those standards are above what the state is asking licensed programs to do. And what CARF accreditation is looking, at the safety, the welfare, and the security of a client while they're in treatment. And are we meeting those standards and providing quality services? And when they talk about quality services, they're talking about the staff who are here, the kind of environment the clients are in, what kind of material is presented to them, what level of therapy we do with them. It includes services from before they hit our door when they first talk to Troy till 1 year after they leave here. So that's a huge commitment for an agency to make, and anybody that's looking to put one of their family members or themselves into treatment, you want a program that meets those standards. I've been a CARF surveyor, I think, almost 10 years, or maybe a little more. I'm not even sure. In the past, when I first started being a CARF surveyor, I probably did maybe 4 or 5 a year. So probably close to 100, maybe somewhere between 80 and 100 programs I've been to. One of the things that I love about 12 Palms, and we tell employees when we hire them, is we truly are a clinical team. And I strive for us to be that clinical team. That there isn't a client who comes into this program that can't have access to any staff member. It's not territorial. If I would have a caseload with 4 clients, it isn't no one else can talk to those clients and they're only my clients. Every single person here works with the clients. If I see somebody that's having an issue, I can look at a client, come walking into group and tell by the look on their face that there's something going on. I'll pull them aside and bring them into my office and say to them, what's happening? Something's different than it was yesterday. It's not an issue. Because we share all of the information. We meet on a weekly basis and we go through every single client, where they are, what steps they're working on. Do they have a sponsor? Are you contacting their family every week? And I have family members call me, because they know that they can have access to me as well as to the therapist or counselor that's handling the client on their caseload. Clients coming into treatment who have been using drugs or alcohol for an extended period of time have just the fear of not having that in their life. It's part of who they are. It's part of their existence. So to let go of that is to let go a piece of them. And then the only thing that's left is them, who they're not sure who or what they are. I don't know if they're so much reinventing themselves as they're discovering who they are. Yeah. And allowing themselves to be able to feel. People that don't get caught up in alcohol and drug use, that's never an issue for them. But for the alcoholic and the drug addict, that's one of the scariest things that, they have to do, is allow themselves to feel. And in the beginning, those feelings are overwhelming, because they've been repressed for years. So there's the things that come into play with somebody choosing to come into treatment, and they know that they have to be detoxed. It's not just the physical piece, it's the emotional and psychological piece that goes along with that. Dual diagnosis has to do with a mental health disorder. And the people here, the licensed people here, myself included, are able to diagnose clients. So you're looking at people that have, a master's degree and then licensure in order to be able to diagnose. And they could have anxiety, they could have depression, they could have bipolar disorder. And so the combination of drug use and mental health gets addressed by the therapeutic staff or the clinical staff here to help them to be able to stabilize both physically and emotionally and mentally. We have relationships with the medical community here that even if clients, if they get the flu or they're on a, rec outing and sprain their ankle, they see one of the physicians here in the community. We have a dentist here who, if they have dental needs that need to be addressed, they can see the dentist. There's a chiropractor here. A lot of people come into treatment who've been taking opiates for years, and maybe it's somebody who has back pain. And so we send them to the chiropractor. Once they get stabilized, they go through the detoxification phase, they go through the post-acute withdrawal phase. We then do something to help them learn how to manage that pain so they don't have to go back to drug use again. One of the beautiful things about this area of the Treasure Coast, it is a really serene kind of area. It's very peaceful here. And with the house being right on the water, it makes it even more peaceful. So as clients get in touch with the spirituality that is part of a recovery program, they want to nurture that. They want to keep it going. So they often remain in the area. We have some clients who actually relocate here. We have some clients who might stay here for 6 months, and then head back home when they feel like they're ready to go back to the environment that they came from. And a lot of times, I'll have parents say to me, well, that's my baby. And I totally get it. And I share that with them, that I totally understand. They don't know us. They've never met us. They have no idea who we are. And I say, whatever I can do, I'm going to help you with. There isn't a member on this clinical team that isn't going to do the same thing. That we totally get. You are entrusting your son, your daughter, your husband, your wife to us, your parent to us, and you're asking us to help you. And there isn't anything we won't do to help them through that process. Their biggest fear is that their family member isn't going to get it or is going to leave. They're scared to death that they're going to get that middle of the night phone call, and they talk to me about that. That they have been petrified, that they know their son or their daughter's out using, and they're always waiting for the phone to ring to hear that their child has OD'd. And a lot of times they are just so relieved. It's the first time in years that they're actually getting a good night's sleep because they know that they're here and they're safe.